2.5 years after the start of the coronavirus pandemic that changed our lives, our world forever, President Biden has declared the pandemic over.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over. If you notice,
The president made the declaration last night on 60 Minutes during a trip to the Detroit Auto Show. Joining us now live is Dr. Peter Chin-Hong from UCSF. Thank you so much for joining us, doctor. So do you agree with the president's assessment that the pandemic is over? And what does that really mean for the average person? Should we throw away our masks? What does this mean?
Well, Liz, I was really surprised by President Biden's remark. I think it took a lot of people by surprise.
Yeah.
And for me, it's not really over. In the hospital, we're still seeing sick people with COVID, even though it's much lower than before. And I think at the heart of the matter is two things, really. Is it predictable? The answer is emphatically no. I don't know when the next increase in cases is going to come. And number two, are we satisfied with the number of deaths that we're seeing? And the answer again is no, because it's about when you average out what we're seeing, it's between 100,000 and 200,000 deaths a year, which is several fold higher than influenza.
Right. The numbers are still incredibly high. And we've seen the numbers trending in the right direction here in the Bay Area. They continue to go down, at least for now. So where do things really stand in terms how much of the virus is still circulating around our region?
Well, we're in the low transmission category now. About 7 out of the 9 Bay Area counties are in low, which means that if you are, non-immunocompromised or elderly and boosted, you can probably go out in most places without a mask. I would still carry my mask around because, again, it all depends on context. And if you're in one of the higher risk categories, you may still want to keep your mask on, particularly if it's crowded, indoors, you're there for a long period of time.
So I guess this lends itself to the next question. When you talk about steps recommended moving forward to protect themselves, we know the vaccines are available. We know the masks work. Anything else that you would suggest folks kind of moving forward in this kind of new reality that they can do to protect themselves from COVID?
Yes, I think one area that we haven't emphasized as much is ventilation.
Okay.
And, it's just as important as masking and testing and in the category of things that we can do to protect ourselves. I know there's been a lot of attention to ventilation in schools, in the workplace. I hope that it continues to be paid attention to because it's the gift that keeps on giving. It's not just for COVID, it's for a whole host of other infectious diseases that are spread in droplets and by airborne routes.
I want to ask you one more question. It has to do with schools because each school is different. Some are requiring masks inside. Some are still are completely saying masks are optional. Where do you think we should land in all of this in terms of kids?
Well, I think it's a moving target. For right now, being in the low transmission zone, I think it's probably okay in a well-ventilated classroom to not have masks right now. Probably in the highest risk kids, their parents may still feel more comfortable for them to wear a mask. But again, watch the numbers like the weather report. You watch the weather report for the kids to wear raincoats and umbrellas. So when the going is tough, you're going to put that mask back on with very low threshold.
And of course, flu season is also right around the corner, so we have to think about that as well. All right, Dr. Peter Chin-Hong from UCSF, thank you so much.
Thanks so much, Liz.